What we'll be completing today is a CMS 1500 form for a patient who has Medicaid insurance. As with other forms, we will start at the top and work our way from top to bottom, left to right. So we need to put the carrier information here at the top. Patient has Medicaid, and need to put the address for where this claim is going to be sent. We can use abbreviations here as well. Notice I did not use any punctuation in the address. In item 1, we mark it that it's a Medicaid claim. Item 1A, we put in the patient's ID number. Item number 2 is left blank on a Medicaid claim because that information will go into item 4. Item number 3 is left blank because that is included in the information that we put into item number 11A. So item number 4 is the insured's name. Notice we put the last name, comma, and the first name, just like we have on other claims. Item number 5 is left blank because that information goes into item number 7. Item number 6 needs to be completed. And with Medicaid claims, the patient relationship to the insured is always going to be self. Now we can go ahead and put in the patient's address here. We complete the street address, the city, the state, and the zip code. And as with other types of claims that we filled out for other types of insurance, we leave the telephone blank. Item number 8 is left blank. Item number 9 is used when a patient has secondary insurance. Item number 10 needs to be filled out. And the patient's condition is not related to their employment, to an auto accident or other accident. Medicaid insurance does not have a policy group or an FECA number, so we're going to leave that blank. Now, this is where we put in the insured's date of birth, is in item number 11A. And our patient is a female. Item number 11B is left blank. Item number 11C on a Medicaid claim is left blank. We don't have to fill that out. We leave 11D blank on a Medicaid claim, as well as item numbers 12 and 13. The reason why we leave item number 12 and 13 blank on a Medicaid claim is that when a patient accepts the insurance, they have already signed a form that says that they will allow their physician to send medical records to Medicaid in order for their claims to be adjudicated. It's part of accepting the Medicaid insurance. Also, as part of accepting the Medicaid, the patient agrees to allow the insurance company or Medicaid to send the payment directly to the physician. So we leave those on a Medicaid claim, we leave those item numbers blank. Item number 14 is the date of the current illness. If we know what that date is, then we can go ahead and we can put that date in there. If we don't know, we're perfectly fine leaving it blank. Item number 15 is the other date. If this is where a patient has been seen before in the office for this particular diagnosis, then we can put that date in there if we know it. If not, we can leave it blank. Item number is 16, that the dates the patient's unable to work in the current occupation. That's for workman's comp claims. We're going to leave that blank. Item number 17 is where we put the name of the referring physician. The patient was referred to us. We put that information here. Otherwise, we can leave it blank. 17B is the NPI number of the referring physician. If we don't put anything in 17, we leave 17B blank. Item number 18 is the hospitalization dates that are related to the current services. We fill this out if the patient was seen in the hospital and we're billing for those services. If it is a patient that we've seen in the office, we leave item number 18 blank. Item number 19 is left blank. Item 20 needs to be filled out, and we need to indicate whether or not there was any outside lab. If we mark item number 20 as a yes, we need to put in what those charges are. Item number 21 is where we put in our diagnosis codes, and our patient was seen for a routine physical. There were some abnormal findings, so we're going to make it a Z00.01. And they also found a lump in the left breast during the physical exam. So we're going to put an N63 there, which indicates that there's a mass in the breast. Item number 22 is a resubmission code. This is not a resubmission, so we do not have to fill this out. Item number 23 is our prior authorization number. We did not have to get this annual physical pre-authorized, so we leave it blank. Item number 24.1 is where we can start putting in our charges now. The patient was seen on the 1st of November. The place of service was seen in the office. That's item number 24B. Item number 24C is where we indicate whether or not this was an emergency visit. It wasn't, it was an annual physical, but we do not have to put anything in this box, so we can leave it blank. Our first code that we're going to do is a 99396. 99396 is actually the evaluation and management code for a preventative medicine visit for a patient between the ages of 40 and 64. And I'm going to indicate that we saw her for reason A. We're going to put in the amount that the visit was, how many times we're going to charge it, and then the physician's NPI number, 901-456-2378. We're also going to charge a second E&M code. And that evaluation and management code is a 99212, which is an office visit for an established patient. It's a level 2 office visit. The reason why we're putting this here is because it was during that annual physical that the physician found the lump in the left breast. And so the physician considered this to be a significant finding, and so the physician went ahead and performed the key components of the level 2 office visit. Now, we have said before that we can only charge one evaluation and management or E&M code per day, per physician, per patient. But there are sometimes some extenuating circumstances that we actually will perform 2 E&M codes in the same day. So how we indicate that is we go ahead and we add the modifier 25 to the second evaluation and management code. This will allow for the payment of this second code. So when we do our diagnosis and we start to link our codes, I don't want to say the reason why I did a 99212 or a regular office visit was because they came in for a physical exam. They're going to deny this. I need to know the reason why we did the second exam. The second exam is the mass of the left breast. So we're going to indicate that. We're going to charge for that particular exam. We're going to charge this code once, and we need to include the physician's NPI number here, 901-456-2378. Item number 25 is the federal tax ID number, and we're going to use an EIN for the clinic. That's 11123459, and it is their EIN number. Patient's account number, we're going to go ahead and put this in here. This is for our reference only. We accept assignment for Medicaid. Item number 28, we total up the charges and we indicate the amount that was paid. Item number 30 is left blank. Item number 31 is left blank. Because we saw the patient in the office, we're going to go ahead and leave item number 32 blank. And now we can go ahead and fill out the information for our billing provider, which is the clinic. Notice that I go ahead and I put in our 10-digit phone number. I use no punctuation. And I'm putting in the information for the clinic here. I can use abbreviations. And I'm going to put the clinic's NPI number in box 33A. And that concludes how to complete a CMS 1500 form for a patient who has Medicaid insurance.